Fidel Castro's last moment is very far away, we were told tonight. The Cuban leader's in hospital and, like some medieval king, has handed power to his brother for a while. The president's hardly likely to be treated like any other citizen of his revolutionary state, but he's lucky to be able to count upon some of the best healthcare in the world. Over the next few weeks, we're going to be looking at the places which have the best public services, health, education, transport and so on, to see what we might learn from them. For Newsnight, and just before Castro fell ill, John Harris produced this personal view.
Fidel Castro's Cuba doesn't look much like a vision of shining success. You could be forgiven for thinking he'd arrived in a slightly threadbare, if sun-soaked version of the 1950s, all peeling buildings, creaking Cadillacs and empty shops. The economic numbers only seem to confirm all that. The national income per head here is about 1/10 the size of the UK's.
But here's the interesting thing. When it comes to the key health indicators, life expectancy, infant mortality, doctor-to-patient ratios, maternal morbidity, Cuba is up there with the world's most advanced nations. And when it comes to the kind of things that health professionals worry about, chiefly preventing illness rather than simply treating it, and public health education, this country is a world leader.
Go over here. Dr. Leia Guido Lopez is the Pan American Health Organization's woman in Havana. She thinks what Cuba has achieved is unquestionable.
En la región tenemos extremos. Haití, Canadá.
In this region we have great extremes. Haiti on the one hand and Canada on the other. If you look at the infant death rate figures, Cuba ranks alongside Canada. Extremely good. Canada's the only country which is better than Cuba. They have an oversupply of doctors and a very professional health service. Here in Cuba they may have limited resources, but despite that, they're still able to match Canada.
One statistic sums up the Cuban miracle perfectly. In the USA, average life expectancy is currently 77.4 years. Here, it's 77.3. A big part of the explanation boils down to where the health system is focused. In Cuba, money is unbelievably tight, so the emphasis is on prevention and, in a very meaningful sense, care in the community.
Now, this is the absolute foundation of the Cuban medical system. This is a consultorio in Jaruco, which is about 30 miles from Havana. Now, there's one of these per 600 of population, and any Cuban is never more than 20 minutes away from one of them. It's a consultorio where a doctor and nurse are both resident that really cements that bond between doctor and patient and makes sure the prevention emphasis really works.
Ana Maria Fuentes is 25 years old. She came to Cuba from Honduras to study medicine when she was 19. Like all doctors trained in Cuba, she has to do 3 years in general practice. The day we met, she was treating Antonio, an AIDS patient. Obviously, he sees her very regularly. But even if you have a clean bill of health, she'll still pay you a visit at least once a year. You can't quite imagine one of the new breed of Boots GPs doing that.
You're looking out here not just for ill people, preventing them getting ill at all is very important, right?
Of course. When you also, with the people that's why you go once to their house, and the people that is in category 1, that's health, you go over there just to make prevention, promotion of health. So you go over there, see the house, you have to say them how to keep the house in a clean environment, health environment, that you can see. You ask if they drink really boiled water.
What about things like eating well and exercise and so on? Do you talk about those things?
Yeah, and I think that finds really hard. Even though you go to their house and you say in the consult you have to make exercise and things like that, and sometimes they say I do, I do, and you go to the house and you always see them sit down in front of TV and things like that. Right. You say, you are not making noise.
So you've really got to hit them with that message.
Yeah,
right.
And sometimes the visits most of the time are people doesn't know you're going to their house. You just go and
you take them by surprise sometimes.
Yeah, of course.
Anna Maria took me on a house call to a local family and their 9-month-old baby, Michael. For his first 6 months, he saw her once a fortnight. These days, it's once a month.
When you come here, you're not just looking for more than the clinic exams, like you go see it once a month, or you have been looking for them. So you come here and see it's like it's healthy. Here, the most important thing is like the environment of the house.
Right. So how's this looking in that area?
It's like right now you see that have the windows closed. It have not too much ventilation. It's like where the things like you said, outdoor it's like clean his house. They try to have it, and also it's real good to have this for the babies or the mosquitoes and things.
Now this is the next tier in the system. This is a polyclinic, and 38 consultorios are affiliated to it. Now essentially the point of a polyclinic like this is to avoid sending someone to hospital unless it's absolutely necessary. So this is the place you come for things like physiotherapy, minor surgery, x-rays, ultrasound, vasectomies, and unbelievably 24-hour dentistry.
Maria Lupe is a cleaner at the local school. She says she visits the dentist here 3 or 4 times a year.
Do you ever pay for any of the treatment that you receive?
No.
No? No. Not anything?
We don't pay for anything, not to see the doctor or the dentist or for any treatment. That's always been the case. In Cuba, we don't have to pay.
So for dentistry, for example, how would you feel if you had to maybe pay a little?
Muy mal.
That would be very bad. I just wouldn't have the money. I hardly have enough to bring up my children. My children would just die if we had to pay.
In general, what's your experience like of the medical system in this country, and particularly the idea that you have to look after yourself?
En Cuba, muy bien. Los atienden muy bien.
It's very good. They look after you very well. If you turn up at a hospital to be treated, then they treat you with kindness, with respect. They don't ask for payment because we simply don't have to pay.
Nosotros no pagamos nada. Lo dan todo gratis.
Do you feel proud as a Cuban, maybe, of your medical system?
Sí.
So does he. That was Fidel agreeing with you.